everybody to Rise Up #2 here. I want to tell everybody a little bit about the background about that, and then we'll introduce my dear friend Gary Hartman, who's here to tell his story tonight. And I think that's really what Rise Up's all about. It's everybody standing up, manning up, telling the story, whether we like it or not, whether it's good or bad. Being willing and brave to tell that story. It helps us individually, but it also has the power to help so many other people out there. So I was inspired to do this by Kyle Stanley, Martin Mendelson, um, and as people come on, if they can mute their video and sound, just because we are recording this and we're going to try to keep it with just Gary and myself on the screen. But uh, Dr. Hartman, you see who's joined us there, Keller.
Is that Keller?
Keller, how's Keller?
Oh,
I
I'm
just
trying
shut
to
her
get
video
going here.
down.
I was
Yeah.
like, who's that old man?
Hey, Keller, you gotta mute yourself, my friend, unless we never get this
all right,
thing.
I'm out of here.
All right. Yeah, Rise Up, Kyle Stanley, Martin Mendelson, Israel Putterman, Ricardo Madrani, and myself have all kind of had our own individual battles, whether it's with you know, mental health of some sort, ADHD, um, addiction, depression, and the list goes on and on. But the five of us, inspired by Kyle, who is brave enough to really bring this into dentistry because he recognized there is a very huge void for dentists that are struggling, that aren't telling their story, that aren't getting help, that don't want to talk about it, that slip it under the carpet and go on their way, and something bad happens if that occurs. Eventually, we break. I don't care who you are and what your battle is. We're human and we break. And this is something that we've got to shout from the mountaintops that, hey, there's other people out here struggling just like you, and let's talk about it. So Kyle's not here tonight. He's actually giving another webinar. I'm hoping that Ricardo and Israel and Martin will join, and maybe towards the end we'll open up the mics and have some time to interact a little bit, because that's where we go from here. After we tell our story, we interact. We create this brotherhood, sisterhood to help each other out. And it one of the most inspiring and moving things for me about this is me being able to have Gary here tonight. But before I introduce Gary to all of you, some of you know him well. I've seen the people that signed up, and I think makes my heart warm, and Gary's too, that you're here tonight. My story is one of which, I'm an undiagnosed ADHD survivor, right? If anybody knows me, they know that I've had it, and I've known I've had it, but I was never medicated. I was never diagnosed. I just managed it, right? It probably gave me some problems as a young man, a young boy, where I was a little bit hard to manage, and got into some troubles here and there. But I overcame it and used it to the mental capacity to help me through life, until you break, right? And a few years ago, in my mid to late 40s, I suffered depression for the first time in my life. Scared the shit out of me. Really, as you guys come on, please mute your videos. Or Jackie, if Jackie can do that for them, so I don't have to do that as we're going on here. Um, that I'm going to go ahead and stop that video. Okay, so yeah, for me personally, um, this depression in my mid 40s, I needed to explain it. I was scared, and it was probably a result of stress and sleep disorder, breathing upper resistance syndrome, apnea, whatever you want to call it. I don't have sleep apnea. It's very mild, and I treat it successfully, and it helps. But I'd be honest with you all that we all have days that aren't as good as the other. And whether that's depression or just managing life, I don't know. But let's certainly talk about it, because when the shit hits the fan, like me, my family, and we're open to talk about this. I have a daughter that struggles with ADHD, thanks to me. And this has been tough for her because she had it so young and had to be medicated. It wasn't an option. She had to be medicated to be able to get through school and manage. And kind of things went downhill, spiraled for her as a very young lady, 14-year-old girl. And her parents had to help figure that out and got a lot of help to help us through it. And we're winning the battle, but it's hard. And we know, our family knows now, that there's tons of other families that are struggling like this. And you need to be able to get out there and talk about it. So that's my kind of story. Not as riveting as Gary's, right? I'm blessed. I'm blessed to have the support. And I think Gary, one of the big things when Gary and I have talked about this, he wouldn't be here today if it wasn't for Shirley. And he'll talk about Shirley, who's a dear friend of mine as well, that Shirley was his God sent, right? When he was praying in prison for his life and for answers, Shirley, even though she wasn't with him, she was there. And he'll tell this story that I think will move us all tonight, that this is, we need support. Whether you get that from a therapist, your spouse, a loved one, your family, your friend, whatever it is, you need the support to get through the struggles of life. Period. Amen. And that's what Rise Up is about. Rise Up is about increasing the awareness to dentists, but in reality, all healthcare providers, right? We live in a stressful day of age, taking care of other people. Sometimes those people are not valuing us. Sometimes those people that we care for really frustrate us. And Kyle Stanley talks a lot about this, that we have to rise up and realize that we're doing the best we possibly can to help other people. We want to continue to do that, but we got to take care of ourselves. Without our sound mind and body, we can't help others. So let's kick this thing off. Let's kick up Rise Up #2 with my dear friend Gary Hartman. Gary and I met in the late 90s in Richmond, Virginia. I was a dental student and he was an incoming dental student. Really cool story is I knew his brother before I knew him. His older brother, Jeff, was a really good friend of mine. And Gary was coming and thinking about dentistry and wanting to do oral surgery. And I, so to say, kind of took him under my wing back then and said, you think about perio, just think about it, keep it in mind. And next thing you know, I'm in residency in San Antonio and Gary's applying, and Gary, moves into the neighborhood that I lived in, and Shirley and Gary and my now wife, Stephanie, befriended each other and became, traveling friends. We went on ski trips and diving trips and just had this awesome relationship develop. And then he moved back to Virginia Beach and bought a very well-known periodontal practice. And I came to Houston and we remained friends, and Gary's life began. And it began just like most of ours with this awesome opportunity to grow a periodontal practice, state of the art, coming from San Antonio, just all of our dreams, right? To start our practice and go do what we had trained so hard to do. And then life takes over. And that's where I want to hand it off to dear Gary. And Gary, I really thank you so much for stepping up, brother. I mean, stepping up in a huge way here to share this story. And I don't think this will be the last time we do this together. So thank you so much for coming on tonight, and thanks Cheryl. I know Cheryl's somewhere in the background for being your godsend, man, because I feel very blessed to have you here tonight.
Thanks, Todd. Yeah, I want to thank you for giving me this opportunity. I mean, I think it's a really cool thing that you're doing. You're going to help a tremendous amount of people. And, I'm here tonight to share a very embarrassing, humbling story that is pretty crazy when you think about it. As Todd mentioned, he and I are colleagues that go way back. We went to dental school together at MCV, and then ended up doing our training out in San Antonio, Texas for 3 years. And so in 2003, I moved back to Virginia Beach, my hometown, and set up my practice and practiced for 15 years before I was stopped by the DEA, had my license revoked, and was sentenced to federal prison, where I spent 3 years, 9 months for fraudulent prescription writing to feed a pretty significant opiate addiction that I had. Yeah, so that's that, as they say. It's my story. I share a bunch. I do a lot of speaker meetings here locally. And I never done this venue though, so it's a little nerve-wracking for me, I must say. But I moved past that because for me, I realized that the more vulnerable I am, the more I can open up and share my story, the more I am able to heal personally and grow. And that has really been my experience because since I've been back, I've just dealt with a lot of, as you can imagine, shame, guilt, embarrassment, regret, insecurity, you name it. Those things have plagued me since all this started. And, when I talk about my story, it helps me move past those things. So that's why I continue to do it. But I also hope to help someone else out there, someone that might be struggling with their own addictions, maybe has family members that are struggling with it, that somehow, some way they can take, pieces of my story or gain some of my experience, strength, and hope that I share to help them, to get them past what can be a debilitating and life-threatening disease. And that is why I do it, to help me, to help others. And so when we talk about our stories in these rooms, in particularly the recovery rooms, we kind of structured around three tenets. Really, it's sort of what it was like, what happened, and what I'm like now. So if that's okay, I think I'm going to just kind of move through my story just like that, Todd, and feel free to
Yeah.
interrupt me if I get carried on or start mumbling on.
No, I think that, I think like we talked about, the stage is yours. We got plenty of time. Some people may have time commitments. You and I don't. So if we stay on here for 2 hours, it's okay with me. We're going to be
All right.
resharing this on Facebook and I do want to, before you go, Gary, I failed to mention that the next Rise Up's going to be in the May, June timeframe with Michael Sonic, who's an author and a periodontist from the Northeast that has a brilliant success story, but he hasn't told his dark story. So we'll talk about his darker story later this year. And then next fall, I hope to bring the Cinco Amigos back. The five of us have started this for kind of our powwow. And then we're really looking forward to 2026 if Kyle is capable to create a live meeting in Los Angeles with Kyle, who really got this started, and get a group of dentists in the same room like he does with Lightside with Martin. And I think I saw Martin join, so super excited to have Martin with us tonight. That we want to take this to the next level. We want to keep it non-for-profit, or if there is profits, they go to the speaker or the speaker's choice of a program that helps with addiction. I was going to close with this, Gary, but I'll get it out of the way now. Two that Gary really wants to make sure people know about is Narcotics Anonymous, kind of like Alcohol Anonymous, and the healthcare providers monitoring system, which most states have. So sorry about that, but I'll give it back to you, Gary. And like I said, yeah,
Oh,
the stage is yours, and yeah, people really want to hear this story. So please.
shoot. Okay. Well, when we talk about our stories, we always, I say we in recovery groups, we like to talk about what that first drink was like, what that first exposure to whatever substance you're addicted to is like. And for me, that happened pretty early. I grew up in Virginia Beach. Virginia Beach, like a lot of beach towns, have, you really develop this art and skill of partying pretty quickly. And that was no different for me. I kind of delved right into that and I, embraced that type of lifestyle. And, I used alcohol primarily for fun, but for me, looking back now, and part of my recovery is examining, how I was as a kid and what my mental state was. I was always really anxious. I was a really anxious kid. Had a lot of anxiety. I was worried. I had this compulsive, obsessive thinking mind that would just not cease. And I still have that today. I struggle with that a lot today, but now I have tools to manage that. Where, when I was younger, I didn't. And so I remember, we always talk about anxiety. It's like, one foot in the past, one foot in the future, and you're just pissing all over today. And that's kind of really the way my story was. I just had this incessant sort of worrying and anxiety growing up. And so I remember my, first time drinking. I not only enjoyed it and had fun with it with friends, et cetera, but I just remember my anxiety and my compulsive thinking just kind of melting away. It was almost as if I found this kind of magical elixir, like, hey, I can be someone I always wanted to be. I can be relaxed in social settings, and I can be this kind of carefree, worry-free person. And so I had this crutch that kind of developed that I carried on through adulthood, and into my career even, where alcohol was becoming this part of my life, this kind of emotional attachment I had to it, which later became a full-blown addiction. Um, but it wasn't long before that caught up to me, and it really became a problem. As with all addictions and alcoholism in particular, it never stays the same. We always talk of it as a progressive disease. It tends to start off sometimes slowly, sometimes quickly, but it always, we talk about in the rooms how it ends in three ways: jails, institutions, or death. And for a real true addict, that's a reality. Seen it and heard it in the rooms and seen stories of it and had personal experiences with it. It's true. And so when looking back at my story, I've checked off two of those boxes already. I've got the jails and institutions checked off. I don't need any more research to realize that that third box is waiting for me. And I was really damn close to dying, having gone through what I went through. And so, that's why I keep my recovery first place. I really, have to. It's sort of life or death for me at this point. And knowing that it's a progressive deadly disease is just in the forefront of my mind at all times. So, this disease was slowly progressing. I was kind of, getting worse and worse over time. And even into dental school and into my career, I was still abusing alcohol and using it as a crutch, and using it as a medication, not knowing what kind of slippery slope that would really be and what kind of consequences could come out of that. Um, Dentistry, as we all know, all my colleagues out there, it is a very stressful, psychologically, emotionally draining profession. It is, you're in someone's personal space all day long. You're waving a needle in front of their face, you're inflicting pain on them. You have to hear things like, no offense, doc, but I hate dentists, and, basically I hate you. And, I think as a, certifiable people pleaser, that kind of really took its toll on me early on. I just couldn't manage that. I remember even coming back from dental school clinics after seeing a full day of patients and just replaying this all in my head all day long. Did I do this right? Could I have done that better? You know, did this person really say they hated me? Did they really hate me? Yada, yada, yada. And
Yep.
it just would, I had to numb it, and that's the only
Yep.
coping mechanism I had. And so I would get home and I remember just pounding alcohol, beer, wine, whatever I can get my hands on every night. And that
Yep.
became a routine for me all the way through, and until it just stopped working. It worked until it didn't, so to speak. But I had this memory in dental school, and Todd, you may remember, in fourth year dental school, we get these like lunch and learns where they faculty comes in and they talk to you about various things like practice management, and one of them was on addiction and the perils of substance abuse. And they had these three doctors, practicing clinicians, come in, and they were talking to the students about their struggles with addiction, and how prevalent it is in our careers, and how basically warning us to watch out, it can happen to us, et cetera. And I remember this endodontist, I think back now, it's just such a vivid memory. Got up there and he spoke and he said, hey, I struggled with an opiate addiction, and I had a practice and I started writing prescriptions, and I ended up losing my license and going to state prison, and all of this, I was hearing this, and I remember thinking to myself, how could this guy ever let himself, do this? That's not me. And in addiction, and early on in recovery, it's all about, the rookie mistake is always identifying out. I'm not that bad, or I drink a lot, but I'm not living under a bridge. And instead of identifying in, you know what I mean? And so it's kind of how I handled that. I was like, I remember telling my buddy, I was like, God, this guy, I mean, he threw it all away. How could he possibly do that? That will never happen to me. Of course, until it did. And that's the irony of it all. Looking back, is just like, wow, had I just heeded that warning, had I just listened. So that's why, I try to reach out to these types of venues as much as I can, just to, maybe someone will listen. Maybe someone will
Yeah.
actually not be like me and take that warning and be like, yeah, this is a career where you're very prone, almost like an occupational hazard. You're very prone to addiction. And if you're not careful, it can get carried away pretty quickly.
Yeah, Gary, and one thing that you bring up is a great point is that when I talked to our good friend Chris Richardson, we realized that we kind of left out the student and probably the most important people out there that we want to gift this to is our dental students. So let's really try to create traction with these stories, because if we can, just like you sitting there in that classroom, and I did the same thing, like that's whatever, let me get out of here. I want to go have a beer, right?
Right.
We got to listen. We got to listen, and we got to take heed to that advice. And hearing these real stories can move someone to listen. It moves me to listen, right? And so, yeah, I mean, I think Chris is hopefully helping us to do something for at least the American Academy of Perio. But let's always think bigger. Who else can we influence? Who else can we change the trajectory of their future, and avoid some of the things that happened to you and me and others by taking the wrong. Just think about this, everybody. Think about all the times in your life where you're at a crossroads and you've got to make a decision. And think about how many times you made the wrong decision, but by God's grace or some grace, you still succeeded. Think about that. You actually were at the crossroads, and you made the shitty decision and you still were okay. When you think about that, you think of all the things for me and Gary. I can tell you there are many crossroads that we went to, and we sat there and we made the poor decision, yet we were spared. Now, Gary, as he continued this, obviously he wasn't spared forever. I have been. Many of my friends have been. But the day may be coming where that bad decision loses your life, your license, a loved one. So this idea of rise up, listen up, listen up, listen up to those people that have failed in the worst possible way, but are still here to tell their story. And that's what this is all about.
100%, and I still talk to that endodontist today. He is back. He's a practicing endodontist. He is 25 years sober. He is a big source of strength for me, because our stories are so closely related. It just, and he gives back to the community and speaks at dental schools and still does what he's been doing for 25 years, and that's something that I think is hugely important. And if you can just reach one person, then it's a win. Had I just listened, which is why I wanted to share that, because it's just such an irony to think, I remember that day vividly in that classroom. But
Yeah.
so it's at this point in my career, I'm back, I'm home, I'm working. I'm definitely getting more and more out of control with alcohol. Blackouts are becoming more frequent. I'm just it very much another thing to mention about alcoholism and addiction is it's a very much a family disease. It is not just affecting the addict or the alcoholic. It affects all your loved ones and everyone around you in a way that you don't really think about at first. It's kind of like this, my wife in particular, they get to a point where they just so desperately want us to change, and they try everything they can to manipulate and do what they can. And they develop this codependency and they become sick, just as sick as we are, and so our marriage really started falling apart, primarily because of my addiction and all that I brought to the table. So, it ended up that in 2009, we ended up getting separated. At this point, I am sick and tired of feeling sick and tired. I'm drinking all the time. I'm sick and tired of being hungover. I'm sick and tired of making excuses and having to wonder what I did or remember what I did the night before. And I get to this point where I'm like, all right, I need help. You know, I moved out of the house. The kids were 3 and 5. Things are not going well for me. So I decide to join this intensive outpatient program. And for people that aren't aware of that, that is it's kind of like a outpatient, you know, rehab facility where you can continue to carry on with your normal activities, work, you can live at home, but every night for 6 weeks, for 4 hours, you basically learn recovery. You go to meetings, you share, you get a sponsor, you learn about the 12 steps. And that's kind of where I first got exposed to what the 12 steps were about. And you know, unfortunately, though, for me, you know, and like a lot of newcomers, it's this I had this program of half measures. And we say half measures avail nothing. They really do in recovery. It's either all in or all out. You know, there's just no easier, softer way. And I didn't know that. And so I was kind of just, you know, going through the processes and not really working the steps. And I had a sponsor. I wasn't talking to him. I wasn't sharing meetings. And you know, I'm in this kind of fragile state where now where I'm not drinking. I'm 2 years now without a drink, but I'm not happy. You know, I'm miserable because at this point now you take away my only crutch, but I don't fix the true problem, which is really in your head. We always talk about addiction, you know, alcohol and the substance is just a symptom. It's not the real cause. The cause is your inability to manage your life on life's terms. And the 12 steps are aimed at really cleaning house. You know, you first start with admitting you're an alcoholic, an addict, and then saying, you know what, I can't do this on my own. I need to have some kind of higher power, some um, power greater than myself that can restore me to sanity because what I'm acting like is I'm insane essentially. And then you start realizing that you have all these fears and resentments that you have to take care of and clear those. And so as you go through these steps, that's what it does is it manages your life. It's kind of a design for living where you clean house, you rely on God, and then you work on your character defects and you try to rely on these steps to keep you from drinking, and it works if you do it right. So I'm in this period of time where I've got these half measures. I'm still smoking pot. You know, I'm not fully sober. They call it the marijuana maintenance program. I decided to fully buy into that one, and it just didn't work. You know, it just didn't work. So for 2 years there, I'm in this state where I'm trying to get sober, but I'm really not working the program. In 2011, I ended up getting this massive shoulder injury. So I was surfing and just got ragdolled and tore my shoulder, dislocated it. It basically ended up tearing my rotator cuff. And at first I thought, you know, I could just shake this off. It's not that bad. You know, it'll heal. And eventually it just started affecting everything that I did. I couldn't sleep. I couldn't even reach for my dental light when I was working. It just was becoming a problem enough that I went and I sought help with a medical doctor and I got it looked at. And at that point, he was looking at my and did my test on my shoulder, and he said, you know, yeah, you really got a bad tear here. You're going to need a surgical consult. I'm going to line you up with this doctor. In the meantime, he prescribed me 120 Vicodin. He gave me this big jar, and I remember at that point when I took it, I thought, now I have an excuse. You know, this is perfect. I have a way to. I didn't like the way I was feeling, and now I can change the way I feel without drinking. So this medicine that I started taking immediately felt it filled this void that I had left with what alcohol left, and I was kind of off to the races with it. You know, I'd already developed this kind of emotional attachment to this opiate that I thought was just the perfect fit for my problem. And so now I go into the surgical consult and met the doctor, and he was like, yeah, you know, your MRI shows that you just have this massive injury. It's going to require a big surgery. You're going to be in a sling for 3 months. You're not going to be able to practice, you know, you're going to be in a lot of pain. And at this point, we decided like we've got to do it. No, this is not going to get better on its own. So we decided to sign up for the surgery. The problem we thought about was, wait a minute, we got to talk to this guy about my history. You know, I have a history of drug abuse and alcoholism. I'm trying to get sober. We need to tell him. So we go and talk to him. And, at that time he was like, yep, I appreciate that. I understand, but I haven't seen anybody recover from this without opiates. You're going to need them. So we came up with this plan where Shirley, my wife, would be sort of the gatekeeper of this medicine. Okay. She's going to take the medicine and hand it out to me as prescribed.
Gary, can you just circle back? You were separated. You went through the recovery process, and then you got back together.
Yeah, sorry. We
prior to
did
this-
end up getting back together.
Okay.
And I guess this, life did improve. I stopped drinking. I was kind of working the steps, and, things got to be a little better. But as I said before, halfway in, halfway out doesn't work, and so I had this kind of, yes, family life got a little better, but, overall I was still very miserable and set up for this kind of disaster that took place.
Yep.
So, excuse me. So, I end up going through the surgery, and this is back in 2011. At first, they stick this big giant needle in your neck and they block your whole arm for 48 hours. So, I didn't feel anything post-operatively. I got out and I thought, this isn't so bad. I can probably manage this without pain meds. But when that block wore off, that was the most intense, centralized, deadening pain I've ever felt. I mean, kind of biting your towel, screaming at night kind of pain. I remember it well. And I immediately just started taking the Percocet. He gave me 60 tablets of Percocet, and Shirley was doling them out to me as prescribed. And I was managing, and so it wasn't long before uh, I started exaggerating, this pain, like, hey, this rehab really tore me up today. I need more. And I was going back and getting refills. And at this point, I'm 100% fully hooked, physically, emotionally, mentally hooked on opiates at this point. And I knew it, but I still felt like, well, no one can smell it. This is perfect. No one can see it. I can still change the way I feel, and I'm just going to keep going like this until he cuts me off because I have a medical reason for this. So he cuts me off, and I don't think I lasted like maybe a day or two before I just had this. The withdrawals were so terrible that I could not
And this
function.
is after how long? So how far post-op are you?
About 2 months now. So yeah, 2 months after, and so two refills, 150 Vicodin, two refills of Percocet. That's all it took. I mean, I was physically dependent on it, to the point where, couldn't get out of bed. I mean, I tried to stop, and it was so brutally incapacitating that I just, and what's crazy about that drug is that you could feel terrible, like shivering, diarrhea, throwing up, unable to get out of bed, unmotivated, terrible mood, but take one pill and 5 minutes later be completely fine.
Hmm.
And so that was this circle of, man, I couldn't break that cycle, and so I try to go cold turkey after he cut me off from refills, and I just couldn't do it. And so out of desperation, I came up with this great idea that I'm a periodontist. I write prescriptions like this all the time. I'm going to ask a friend to fill this for me. I'm going to write him a prescription, and he'll just give them back to me, and everything will work out great. And it did. It was easy. Back then, opiates were prescribed. I think Vicodin was Schedule 3, maybe still is, but it was just you could call it in and get 60 tablets, three refills, no questions asked. It was just too easy. And so that pattern kind of carried on for a very long time. One person, once I would felt like I used up all the risk of getting caught with that one person, I would switch to another. And next thing you know, I got a handful of people that I've done this with, and it just was a pattern that, I couldn't break. But at the same time, I was able to keep this from everybody. I managed to never get like a real euphoric high. It was just kind of like I was able to function. You know, I just wasn't sick. And it was that hell I was living in that, you know, if I didn't take the pills, I couldn't function. I was sick. If I did take them, then I could be quote unquote normal. And I kind of kept that from everybody for a very long time. I remember, you know, knowing that I needed to stop. I would try and I couldn't last more than 2 or 3 days before just giving in and getting deathly ill. And, you know, it became this hell that I was living through that, you know, I kind of finally succumbed to the fact that I was either going to die from this or I was going to get stopped. Those two things. So eventually that day came where I got stopped. And I talk about this.
One more thing though, one more
Oh, yeah.
question before you get
Good.
to the day.
Okay.
Um, this period of time where you were addicted to opiates, and you weren't intoxicated, like you were fully functional, right? You were seeing
Right.
patients, you weren't using alcohol, you were
Oh,
just using opiates, and you weren't drugged out. It's not like you were using heroin and just out of it, right? I mean, you were
right.
very, very functional, right?
Correct. Yeah, practice was thriving. In fact, we just renovated our office. You know, practice was growing to the point where it was just, you know, I was a victim of my own success. So the busier I got, the more stressed I got, the more I needed the opiate. You know, it was just kind of just endless circle that I had to deal
And this
with
from the shoulder surgery to the DEA was how many years?
for maybe 5 years.
5 years. Wow.
Mhm. That's how long that was kept from everybody. My wife, my patients, my friends, my colleagues, my staff. I mean, no one had a clue.
But the friends that you were writing scripts for, were they users, or they were just friends that said, were they users
Both,
too?
both.
Both.
So sometimes they would take, like they would, you know, so that's the other thing. I never sold them, you know. So when I ended up getting in trouble, which I'll get to, you know, they were just like, well, you just used them for your own benefit, but the fact that you used somebody and the drugs changed hands, that's why we're going to call this distribution, just like a drug dealer on the street would get charged. And so, um, they, depending on who they were, would either give me all of them back. Sometimes I would pay for them, or they would just take 10 and give me 40 or whatever it was, you know. And so, you know, that pattern kind of continued for a long, long time. And, you know, like I said, that day eventually came. Which I knew would, you know, every day I'd wake up in a panic. You know, of course, I'm already, you know, the duality of just this double life that I'm living is ripping me up like a cancer. Um, I'm already just stressed about that. And then I'm stressed about every single day. Is this the day that I'm going to get my door kicked in by the DEA? Knowing that that's my only out, either that or death, because I tried to stop and I couldn't.
And the other parallel here is, in the midst of this, the opiate crisis is in full blown
Correct.
go,
Yeah.
right?
Yeah.
Full blown go mode. So I mean, you're not naive to that.
Right.
You know that's going on too, right? So
Yeah.
that's
Of course.
increasing your stress, even like, holy shit.
Yeah, and the restrictions are getting tighter and tighter, and the prescription monitoring program's starting to come out. You know, because I remember when we first started, it was just, I
Yeah.
mean, opiates were prescribed. My doctor, I doubt now they would even prescribe half as many, if any, of those narcotics that
Yeah.
he gave me for those surgeries. You know, but it was kind of at the time, you know, they said in medicine it was like the fifth, what they call the fifth vital sign. You know, pain. You have to treat that, or you're not treating your patients
Right.
well. You
Yeah.
know, and so they were
I
like,
think yeah, sorry, for the non-dentist out there listening, for dentistry, especially because of tooth extractions, third molar extractions, and as a periodontist oral surgeon, you're always doing surgery. If you didn't prescribe a narcotic, you're doing harm, right? So in the surgeon's mind, every patient left with a script for Vicodin, Ultram, Norco, Percocet, Percodan, that was just the way it was.
right,
Now it's a totally different ballgame. There's actually research to substantiate that two Advil and one Tylenol is equal to one Percocet. So we have actually pain data to say if we're truly treating pain, we don't need narcs. So the world's changed. But now when we're talking about Gary in between 2011 and 2017, this is full blown, this is what you do. You don't not prescribe a narcotic. If you take out wisdom teeth and you don't prescribe a narcotic, you're a bad surgeon.
Right. You're not treating the patient right. Yeah, yeah, exactly. So the day that it happened, I remember it was June. It was a beautiful early summer day. It was a Friday, in my office. I just numbed a patient. I was getting ready to do an implant on number 19, simple implant. I thought this is easy day, beautiful outside. So I walk outside to get some fresh air while the patient's getting numb. And
Are you on drugs at this moment?
well, yes, I mean, obviously it's a nonstop thing. I was still.
So how often are you dosing? Like when you
No, I
wake
tried
up,
to be good about it during the day because I didn't want to be out of control. I always kept my patients first place. So it was kind of like morning and afterwards, you know what
Yep,
I mean?
yep,
But yeah, you could say it was in my system for sure.
yep,
And
yep.
yeah, so I walk outside and I'm on my phone and this man approaches me and he walks up to me. He's like, Dr. Hartman. I thought, man, I don't have time for this. This is a sales rep. I'm like, I don't have time right now. Sorry, I'm in the middle of it. He's like, oh, you have time. And he flashed his badge and he was like, I'm DEA. He goes, I know exactly what you've been doing. He goes, I have been following you for a year and it's over. You're in deep trouble. And I at first was like, what are you talking about? I don't know. And then finally I was like, oh man, there's no getting out. This is bad. So they basically escort me into my office. Within minutes, 10 DEA agents storm my office with, DA written all over their backs, dogs, German shepherds surrounding my office, sniffing everywhere. They interview my staff. They take all my computers. They take my phone. They impound my car. And they basically were like, look, it's over. You're not practicing anymore. We have a stop order for your license to be summarily suspended. Um, but you're not under arrest. You're under investigation. So you're free to go. So I remember though, as bad as this was, I remember just sinking down in my chair and just being like, thank God this is over. I mean, I don't have to die. This is, done. I can get help now. And that sense of relief that I had on a day where you thought I would just be stricken with panic was completely ironic, but makes sense now. It's how bad I was. So the worst part about all that was now I'm thinking, okay, I have no car. I have to walk this walk of shame across the parking lot over to 7-Eleven and call Shirley and tell her everything. So I did. I went and used the phone. I remember talking to her, and she was in cooking lunch for the kids, getting ready to go to swim team, perfect summer day. And the next thing you know, her life is just ripped apart and turned upside down. And I was the cause for all of that. And so you can imagine how that phone call was. Um, Telling her, hey, listen, I just got stormed by the DEA. I've been writing prescriptions. I'm a full blown addict. I need help. Can you come pick me up? And man, that was brutal as you can imagine. So that started this right then and there. Opiates stopped, everything stopped, and I went into full blown withdrawal and had one of the worst weekends. I spent the weekend with my parents. They had to watch their son shivering and dying basically in the bed in front of them, and just the amount of pain I inflicted on my family and my wife and my kids. They were 11 and 13 at the time, trying to explain this to them, how brutal that was. I got through the weekend, and on that Sunday, I ended up getting checked into a rehab facility where I spent the next 90 days in inpatient rehab. First week was complete hell and detox. Um, but here is when I started really turning around and really working the program. Like, God, I just surrendered, man. I get it. This is, I've really, no more my way, and started working the program and got through rehab. I get home in the end of September of 2019. And at this point, I'm not practicing. I get back, but there was this just sheer panic, the misery of this, what's going to happen. As we're waiting for this other shoe to drop. Investigators are telling me, hey, we're still investigating you. My attorney was like, listen, we don't need to call them. If they don't call us, just let a sleeping dog lie. Well, it wasn't long before I realized, how much trouble I was in. I mean, they told me, hey, you are getting charged with conspiracy because you used 10 people over a period of 5 years. And because it changed hands, the drugs actually changed hands. You got prescriptions for them. They gave them back to you. It's called distribution. So I'm getting charged with a felony count, which is exactly the same that you would give like a heroin dealer on the street, that runs a trap house. Like I'm in deep trouble. And so at this point, we're in this state of fear, anxiety of just, no one really kind of knew at this point. It was kind of under wraps. I mean, our close friends and family knew, of course, the patients knew to some degree. But we plug along through the year and get to February 19th, my wife's birthday. All of a sudden, I get this phone call and it's like, hey, did you see the news? You're all over the news. And within minutes, it was just all over the place. Channel 3, 10, 13, morning news, night, my picture, my office picture, these stories that were all based on a lot of allegations where, I'm running the biggest opiate ring in the East Coast. And
Yeah, Jimmy Fallon, right? You're on Jimmy Fallon.
yeah, yeah,
Yeah.
yeah. I didn't actually know about that till later, but I did hear that. So yeah, it made so happy birthday, Shirley.
Yeah.
It was rough. I mean, it's so we have this, I'm telling my kids too, look, you don't need to go to school. They're just worried about what their teachers and all the people are saying. I felt like, on Goodfellas when I was looking out the window for the helicopter circling overhead every day, it was just this paranoia nightmare.
Yeah.
So it actually gets worse. I head into like February, March timeframe, and I get my attorney is basically like you're going to plead guilty, go in. This is just a formality. You're going to go in and basically say yes, sir, and sign these papers, and you go home and wait your sentencing, and that'll be in October, and so you'll be able to get your affairs in order. So on May 19th, I go in the federal courthouse and plead guilty to one count of felony drug distribution. And the judge just wanted none of it. I mean, he basically looked at me like, you're no better than a heroin addict. I think he said, he was like, you betrayed the public trust. You're basically worthless, and I'm going to treat you no differently than anybody else. And he remanded me right into custody right then and there. So in front of all my family and friends, I get handcuffed by the marshal right in the courtroom and taken out. And I can just remember this screaming and crying and looking at my mom and seeing her face and just my wife going, no, it was just awful. I mean, brutal day. I get put in a paddy wagon. I've never even been in court before. This is the first time I've ever had handcuffs on, and I'm stuffed in this paddy wagon and sent to jail where I spent 6 months in Western Tidewater Regional Jail awaiting my sentencing.
And at this point, you were thinking you're going to court, and that night you're supposed to go home and be with your kids,
Right.
right?
So never kissed them goodbye. Told them, in fact, I'll be home for dinner, just going into court, sign a couple papers, I'll be back. Never got my affairs in order, never kissed my dog, never hugged my parents, just gone. From that point on, 4 years after that, before I saw the light of day. So that was brutal. We ended up getting through that, and in October, the day after my 47th birthday, I go into court for my sentencing. At this point, my attorney's saying, hey, this is your first time. You've never been in trouble before. You really were an addict. We're thinking like a year. You may do 6 months. And in front of everybody again, this time I'm in a jumpsuit. The judge hands me 100-month prison sentence. And basically, all I remember from that point, talk about a knee buckling, just kind of blackout. I'm there trying to think, 100 divided by 12. What is that? Uh, 8.5 years, 8 years, 4 months, um, and just get carted away. And then that was it. I transferred to Petersburg, minimum security prison camp, where I spent 2 years. And then after that, transferred to Allenwood, Pennsylvania for about a year and a half before I was released for home confinement, March of 23. And I spent 16 months on home confinement and was just released this past August of 24. So yeah, that's kind of the rundown on that. I tell that story, and a lot of people are like, "Wow, that's just amazing." But what they really want to know is what was prison like? That's the question I get a lot, and probably could touch on that for a little bit. I don't know how we're doing on time, but
We're I'll just tell you, we got like 12 minutes left, but
okay.
like I said, well, let's carry on. I mean, I think, for sure, I think everybody wants to hear about your savior in prison.
Well,
When you want to
yeah,
tell that, you want to talk about the seamstress? I want to hear this. Yes.
yeah. Well, you got to use that word carefully. Don't say seamstress in prison.
Yeah.
Tailor,
Taylor.
tailor.
Yeah. Got it.
No, so prison was not fun. I mean, I don't recommend it to anybody. By far, the worst thing was being away from family and, wife and kids, and just countless nights of just crying in my pillow and brutal this realization that this is my life, and all the time that you have to think about it. I mean, crying in prison you don't do. So you basically, there are plenty of people in there that take advantage of the weak. So you found ways to do that. I'd be in the shower and cry it out, or at nighttime just in my pillow, just brutal, brutal nights of craziness.
And,
Prison,
and, and COVID fits into this, and so does, your darkest day, right? So
for
make sure
sure.
before you get to the kind, it's not funny, but about your cellmate and who the guy that had your back and all that. But tell first about the COVID experience, and you haven't been able to talk to your family, and that night where you thought it was over.
Yeah, COVID was interesting. We went from this period of, well, prison wasn't so bad. We got from jail, where I spent 6 months and never stepped outside once. So, to prison, which, you hear jail's terrible, prison's not bad. Well, prison's bad, but it's not as bad as jail. You got a lot more freedom. You have a job, you can walk outside, you can go to rec, you can do different things, and you kind of develop this. Really, you have to kind of make a life for yourself. Otherwise, it's just brutal. You can just wither up and sleep in your bed all day. But COVID, yeah, put an end to that. It was just these restrictions that, you can't, we couldn't get visitation. We couldn't talk on the phone more than 5 minutes at 7:30 in the morning. We couldn't go to work. We couldn't go to rec. You basically had to sit in your cell. We had this open bay dorm, but it was just like maximum security prison almost for 2, 3 years. I mean, it was bad. We couldn't go to the cafeteria. Food was brought to us, and we just had to, you know, manage the best you can. And the worst part about that was, here my kids are 11 and 13. I didn't see them or Shirley for a year and a half. Didn't really even talk to them much. So at that age, you talk about your kids. And my son's 11. 1 year is a big difference. He shot up 5 inches, got a deep voice all of a sudden. And, I just missed so much. There's so much that I missed. And that's what I remember the most, was that in this loneliest, desolate, worst place you could possibly imagine yourself in, I was in a period of time where I was in, isolation, and in this 9 foot by 10 foot room with just a little slat window that allowed light to come in, and all you could do was just sit on the edge of your bed and just watch the shadows move across the floor. I mean, time went in reverse. It was brutal, and you're stuck with your thoughts. And I thought to myself, there's no way I'm going to make this. I can't do this much time. How am I going to? And I got to the point where I got on my knees and I prayed to God. I said, help me, please. Just either take me or fix me, but I cannot go on like this. And it wasn't long, it sounds corny, but we talk about these spiritual awakenings and recovery. And it wasn't like it was this bolt of lightning or this flash of light, but I had this kind of overwhelming presence that, I wasn't alone. It was profound, to the point where I have no question about my higher power today as God, and that's who I choose my higher power to, that's who I call him. But it was, that's what gave me the strength to move on. And that presence in the loneliest spot I can ever imagine myself in the whole world made me feel comfort and gave me the strength to press on. And that's kind of how I did it, 1 minute, 1 hour, one day at a time. And no doubt about it, Shirley and the kids were my source of strength. They stuck by me the whole way. Without them, there's nothing, I couldn't have done it. In fact, if they're listening, you guys are the reasons I made it. I mean, I did it for you. I did it for my wife and kids, and I couldn't let them down again. I had to
Yeah.
make it through it. So that, besides my mom and dad and my wife and kids, my support with family and friends was just tremendous. And it hasn't ended, even since I've gotten back. It's just this outpouring of support and overwhelming understanding. And my biggest fear was I would just be ostracized and gossiped about and misunderstood and all sorts of things that haven't really come true.
Yeah.
But
Thank you.
yeah, I can go. I mean, I got so many stories about prison. I can go on and on about that all day long.
Well, I think the good thing here is that we're going to do this again,
Yeah,
and we still got a few minutes left. So I think if you could tell the story about the person that had your back, I mean, and a little bit about the tailoring you did to get yourself the coin you needed to make the best out of
are you talking about the which one? Got a lot of different stories about
it.
that,
So
but
there's I thought it was your cellmate, but maybe not. But it was a
oh yeah,
big
ICE.
black
Yeah,
guy that really helped you out, that really
yeah,
had your
yeah.
back.
So in prison, you have this hierarchy of, it's kind of like Lord of the Flies. If you are deemed valuable on this little island, then you get respect. And so you walk in as a doctor, automatically, people are kind of like, okay, well, we could use you. So immediately I was, getting consults for, hey, take a look at this extraction socket. Is this healing well? Or, I've got this cracked tooth. They want to pull it. I don't know about that. And I was developing treatment plans for these guys that are getting ready to leave prison that had these, complex cases of missing teeth and such. And wanted to present that to their dentist. And so it wasn't long before, you got respect in that manner. I mean, the correctional officers didn't care. You were 933-90083. You remember your number real quick because that's who you are in there. And that's all they care about. You're not a doctor in there. But the prison population definitely did, kind of give you that respect. And I had this really big guy, he's like 350-pound dude that I walked in on, and my first night there, and he just growled at me when I walked in. I think it was like a bear. I remember just going, I'm dead. I mean, I'm not going to live. And it turned out, this guy, Ice, he's in there for 20 years. I mean, he became my best buddy. He ran the rec yard. He was this feared guy that people would just respect. And so I, as his roommate, first of all, I was the dentist, the doctor, the doc. And then secondly, I developed this little hustle that I watched this kid when I first got there, and he was tailoring clothes, and I was kind of interested in it because I saw him doing some stitching, and I was like, "What is he doing, man? A simple continuous interlocking would work great here." So I started showing him some of my stitching techniques, and lo and behold, I like became this apprentice of his. And he was like, "Wow, man, show me another one." I'd show him the horizontal mattress, vertical mattress, the surgical knot, and they were like, "God." So this guy ends up teaching me the ropes. And in prison, we get these khakis. They're just standard issued, But all the guys, especially younger guys, they want these tailored, slim fit cut jeans that, I mean, tight around their ankles, tight around their biceps, tailored fit. And so I became the tailor in prison after this guy left, and I just had a racket. I mean, I was so busy in there, and it was definitely a way to kill time. You know, they would line
And
up.
you get paid in your ruples or whatever you call it,
Yeah,
right?
so there's no money in there, but you have this little micro economy. So they develop a system where if you go to the commissary and buy fish, right, these mackerels that come in a little pouch, they call them macs. They're worth $1. So you get one mac equals $1. So everything you want in there, if you want a haircut, if you want shoes, if you want, to buy certain things, food, you have to pay in max. And so I would tailor these clothes and get 5 max a pair. And I mean, I had stacks of them on my bed. Just guys were like asking me to bump them up in the line, and I kind of almost developed this little brand for myself. They were like, other guys tried to do it and they were like, no, I want Doc to do it,
Oh,
and so
Doc. Yeah.
Doc doing the tailoring. Yeah, so it was I wish I had a handbook, of what to expect in prison because it really was a learn as you go type thing, and
Yeah. But your fears were no one messed with you at all because of that one guy, right? He
yeah,
kind
yeah. Once you get asked right away what kind of car you want to be in. I'm like, car? What the heck's a car? And a car is how you identify yourself. You want to be in the white car, the black car, the Hispanic car. I was like, I don't know. And this big bald guy came up to me and was like, you're in the white car. It was the very first thing I realized is he's the shot caller and he's in charge of running the show for the white people. And everything's separated by race in there. Unfortunately, it's bizarre, but he checks out your paperwork right away. They look and make sure, and your paperwork is your court documents. They make sure that you're not a child molester or a snitch. If you didn't cooperate with the government, if you're one of those two things, your entire prison stay is absolute nightmare. I mean, extortions, beatings, just you name it, isolation. They have to stand up when they eat in the cafeteria. They can't watch TV. You can't talk to them. And so, fortunately, my paperwork checked out. I was in this car that this shot caller kind of protected you and made things all right. And I've suddenly found myself in this environment. Like, what in the? There are certain times when I was in there when I had this realization. Like, look how far I've fallen, I'm in there buffing the floors as a job for the chow hall as my job, and I'm running this buffer over these every inch of this floor, thinking to myself, man, look at what I'm doing now compared to what I used to do. Look at where addiction brought me, and it was this realization that, man, this is what happens if left unchecked. This is how far you can go.
yeah.
But could maybe wrap it up by just talking about what I'm like now. Today, I don't think you get through an experience like that and not be changed. It's definitely something that changed me, changed me for the better. I'm definitely more compassionate person, more humble, more grounded and present. I think I definitely don't take things for granted like I used to. You kind of realize quickly when it's all pulled away from you how good you really had it, and I think the way I was living life before, I was just ripping through life with complete unaware of how good life really is. And then it's taken away and you're put in this little cell by yourself, removed from your family and buffing floors and working for Max and all these things just humble you to the point where it just changes you. And I have, got a really kind of a brand new perspective on things. I keep God first place for me. He was there when I needed him the most and got me through the darkest of times. Family recovery is first place for me. If I don't take care of myself emotionally, spiritually, mentally, I'm no good for anybody else. I do everything I can to try to help people, particularly people in recovery, especially the newcomer. If something bothers me today, I find that I have to share it. I can't keep that bottled up. My old way of doing that, where I would isolate and just try to deal with it in my head, didn't work. It led me to this addiction crisis that just kind of took off. So now, as they say, a problem shared is a problem cut in half. I share everything that's going through my head, whether I talk in meetings or counselor or to my sponsor or to different recovery groups. It's just a different way of handling things. I realized that, I'm passionate about dentistry and I miss it. There isn't a day that goes by that I haven't thought about how much I missed and miss helping patients. What that when that was taken away, you don't realize again, I took that for granted. What a special treat that is to be able to have a skill to that you can hone and master and provide care to somebody and repeat that over and over and get predictable results and then enjoy that respect and appreciation you get from patients. And that's something that I've spent my last year really working hard toward trying to get that back. I'm going to give it a good shot here. I spent the last year at MCV in dental school going through a refresher program, and I've got myself in a position now where I'm applying for my license reinstatement. And that's all kind of coming down the pipe now, and we'll see where it takes me, but
What are you doing for work right now?
work right now, I work at a company that is, I'm in charge of I'm basically an operations manager for a tactical sales group. It's a former Navy SEAL that set up a tactical sales division that sells special equipment to special forces here in Virginia Beach. And I realized quickly it's just, it's an accounting job. I'm at a computer all day long. I'm fortunate enough to be employed and it helps my family financially right now, but it's definitely the personal fulfillment and that I don't know that void that I had left with dentistry is still there, and it's kind of what I want to do. So it's that's my goal. That sense of purpose that I needed and I still need today is kind of my focus. And I hope this tonight. I appreciate you giving me this time, Todd, and I hope, like I said, some way this can help somebody that is
Yeah.
struggling and maybe perhaps can find a way to make changes in their own lives to better themselves or realize there is hope. In my story, you can find hope and strength in the most sordid and terrible places you can possibly imagine and survive. If you
Yeah.
work the steps, put recovery first place, and keep doing the right next thing, the promises of this program do come true, and I think I'm an example of that.
Yeah. That's awesome, man. I mean, thank you. I can't thank you enough.
Yeah.
Chat room is open. I'm just going to throw a couple, take an
Right.
extra 5 minutes or so. And the first one is, if there's a dentist that has a problem, where do they go? Is there a hotline? We already mentioned the once you're in trouble, the doctor manage or doctor monitoring program is available in most states. But do you know of anything other than, Alcohol Anonymous and Narcotics Anonymous that you can call a hotline?
I don't. I think, the main thing to think about there, and really times have changed over the past 10 years. There are programs that are developing and they're doing it up at MCV right now where they're having these systems in place where anybody that needs help that has addiction problems, they can go reach out to this group that's a subsidiary of the teaching hospital there, and they can help you anonymously without any risk of punishment. And so that's the first thing is that I think there's starting to be more and more legislation, and the Virginia Board of Dentistry is starting to engage in that, and I think that's going to start happening nationwide. But tons of places to go. Recovery centers, don't forget about the IOP, the intensive outpatient programs that you can go to where you can still continue on your life and not go to rehab. Um, but yeah, I mean, any type of addiction counseling, all those things help.
Do you have any type of coach or someone you consider I know you talked about a sponsor, but anything that's more individualized to you, Gary?
Yeah, I go and see an addiction specialist who is a psychologist who is in action recovery now for 30 years himself. So he fully understands addiction and then also treats it daily. And, I meet him twice a month and, I he knows everything about me. And the good thing about that is that he understands the steps and what recovery is like and how dangerous relapse is and the perils and just how hard it is, how hard recovery can be. And, of course, this social stigma that's involved in it too. As healthcare providers, we're supposed to be perfect. We're not supposed to have any of these blemishes, but I think that's becoming less and less a factor as time goes on.
Yeah. Well, what I'd like to do is here, there's some couple people, your friends saying thank you.
Oh, yeah.
Bruce Hauser's giving you a shout out.
Bruce.
Of course, Keller and my one of my dear friends and my surgical assistant for the last many years, an oral surgeon from Venezuela, came to America. Was an assistant. He was an oral surgeon from Venezuela, and now he's in residency. He's up in Baylor, going to perio residency, and he came on tonight, and he said how valuable this is for a student to hear. And thank you so much for your time. So I think that, like Chris Richardson said, that this is where this story needs to be heard. It's in these young individuals that have no idea the stress that awaits them. I mean, school is stressful, but heck, you and I had a hell of a lot of fun in dental school and residency, right? It wasn't that stressful. And
Yeah.
stressful is life, building a practice, taking on debt, raising kids,
Mhm.
you name it. I mean, the things that come at us in life, even if you've got a blessed life like we do, like I do, it's still hard and it takes its toll. And you have to have an outlet for it. You have to do what you just said, and that is tell people your struggles. Don't keep them inside. Tell them to find a friend, someone, a confidant that you can tell anything to, and get it off your chest. And it's going to make you stronger, and it's probably going to help your friend out too, hearing it, so they can share more themselves. So with that said, I'd really ask everybody, we didn't lose hardly anybody, but before everybody goes off, I'd really love for you to put your video on so we can see everybody on the screen, so I can get a quick picture of everybody. Give us a wave, say hello. And I'll give you just a minute to find your video button, and we can get a quick pic, because I think Gary also can see he's got some pretty awesome people joining here.
Yeah, it's good to see these names I haven't heard from in so long. Um,
Yeah, awesome. That's a few. There's
yeah,
more. I'm
yeah.
sure some aren't wanting to share, which is fine too. But thanks everybody for coming on. And Gary, I can't thank you enough for doing
Hey,
this.
thank you,
Um,
Todd. I
yeah,
appreciate you setting
we
this
will.
up and
We
giving me
will
this
definitely
opportunity.
be in touch soon.
Yeah,
Thanks for sharing your story, Gary. Yeah,
100%. Thanks
Yeah.
for listening. Glad I could do it.
yeah.
Thank you so much. Appreciate it.
Welcome.
Thanks everybody for joining, and keep your eyes open. We'll have this type of stuff on IHDS website going forward, and you can always just email me or however you found out about this. Let me know, and we'll keep you informed. Thanks everybody, and Gary, you're still there too. Yeah, Gary, man, peace out, brother.
You see, Todd.
Love you,
Thank
man. Take care.
Later,
Yeah,
man.
I appreciate it.
Thanks everybody for coming on.
Yeah. Good night.
Good night.
Thanks for hosting.
You bet.